Hello, everyone. This is Dr. Rahman Chung, and this is Jessica Tolentino. We're at Neuraxis Health today in San Francisco, and we're really excited to present the topic today of categories of concussion, how to properly diagnose, differentiate where symptoms are coming from, and lead to more effective and personalized therapies and better outcomes. We're just going to jump right into it, to the presentation, and share my screen here. At Neuraxis Health, it's our mission to transform lives through personalized neurotherapy and rehabilitation. I got my start in chiropractic and chiropractic neurology 18 years ago, and it all started with injuries as a competitive skateboarder. In my teens, I was sponsored by several companies. I was supposed to go pro by the time I was 17, and then I started getting a lot of recurrent injuries that led to me questioning the longevity of the sport, and that led for me to go into a lot of alternative medicine treatments like massage and chiropractic and acupuncture. And I really appreciated the mind-body connection that I experienced with those therapies and how it led to better performance in the sport. But it still wasn't enough at the time. There weren't as many skilled practitioners to really put all the pieces together and how I should really treat and strengthen my body and my mind to really participate at a sport at such a high impact level. But I decided to quit skateboarding and go to college in Montana. I got a snowboard, and then I ended up waking up in the hospital from a concussion and a dislocated shoulder. From that point on, I knew I just was going to explore alternative medicine as a career. I took a sabbatical off of college, and I started the journey of lots of different training in herbology and natural medicine. I mentored with an English osteopath with cranial fluid dynamics and what's called ontological kinesiology. It's like a spiritual psychosocial approach to facilitate health and healing that integrates lots of different therapeutic techniques. And then eventually led into chiropractic, all those different technique styles, and then finally functional neurology, where my expertise lies today. And then combining that with neurotherapy, training brain waves and other forms of neuromodulation for the brain. I'm going to pass it on to Dr. Tolentino, and I'll be right back.
Thank you for that. My name is Dr. Jessica Tolentino, and I originally got my start in the field of QEEG and neurofeedback a little over 10 years ago when I was in undergrad at UCLA. I was studying psychobiology and was working in an intensive outpatient substance abuse clinic, so working more in the field of psychology. But eventually saw the power of neurofeedback and these technologies to not only heal the brain in that specific context, but in most other contexts as well, and just the power of the brain to heal itself when given the proper support and the proper opportunities. So when I learned about neurofeedback and that power, it really was a goal of mine to dedicate my time to learn as much as I could to bring awareness and bring access to these technologies to more people, because I saw how important it was for helping people out. So that's what I've been doing now a little over 10 years. And now I'm working here with Dr. Chung, and we're bringing these techniques together to really support better patient outcomes. And I'm really excited to get to share some of that work with you guys today.
Excellent. At our office at Neuraxis Health, we're centrally located right in the Russian Hill district on Van Ness and Jackson Street. And our office is designed in a very minimalist type of style and able to help limit triggers with people who are very sensitive from concussion with all the different visual and light and sound sensitivities. So it's very quiet off of a main street. And we have every single kind of tool to help with sport and spine conditions, neurorehabilitation, like you see this white and black machine here for balance and strength training, and lots of other vision and balance and therapeutic tools. We have one of our exam rooms here that has visual and vestibular testing, as well as our comprehensive neurological exams. And, the agenda today, we're going to be covering, what is a concussion? As most of you know, if you've had a concussion, are familiar with a lot of the different symptoms. But we're going to go into the categories and subtypes of concussion and how we utilize our functional neurology evaluation at our office to differentiate the different categories, and then how to personalize neurotherapy and rehabilitation. We're going to go then again into more detail about the functional neurology evaluation and each of the component tests, what kind of data we get from it, what it means, and how we can use that for therapy. And then we're going to present a case study and then go into each type of therapy that we do at our office. And finally, we'll have some Q&A times and review also the new and exciting remote neurotherapy programs that we have, because a lot of people can't make it into the office or frequently enough, or they're traveling from out of the area and need support with better tools and guidance. So concussion is considered also a mild traumatic brain injury. And it's caused by a blow or a jolt to the head or body that can disrupt brain function. Sometimes there's a loss of consciousness, or none at all. And it's not uncommon to have no loss of consciousness with a concussion, but you'll have symptoms of headache, dizziness, maybe some memory issues or forgetfulness, concentration, mood changes, sleep disruption, and many other kinds of symptoms. But the symptoms usually are fairly short-lived in most cases. Within a few weeks, there's some stats about 14 to 30 days, about 80% of concussions resolve, but more sensitive and more thorough research actually using objective measures shows that actually many cases take over a year to recover or still have persisting symptoms after that point. And that's probably why most of you are probably here watching this today. The pathophysiology of concussion is about how different parts of the brain, from cells and structure to the physiology of cells, are affected by this kind of injury. Starting on the image of the left with the brain, you have, say, a structural site of injury where there's a disruption of the tissue. And in that tissue, there are blood vessels that can become bruised and leaky or even ruptured in more severe cases of more moderate and severe brain injuries. But this causes a leak and inflammatory aspects and cell damage that create an inflammatory cascade that leads to lots of symptoms, and then hyperexcitability of the surrounding brain regions or cells that cause even more symptoms and lead to potentially cell death, and even later on kind of retrograde degeneration of pathways depending on the severity of injury. So this process leads to swelling and edema, and that leads to more structural compression and all these other factors that happen to damage cell function and what that region of the brain actually does functionally. One of the common things that occur that imaging sometimes has a difficulty identifying is called diffuse axonal injury. So if you imagine the brain is sitting in a bony skull, the brain is the consistency of jello, and it's sitting in a bony skull with lots of sharp edges. And when you have a blow or jolt to the head and body, this creates a whiplash effect. The brain shears forward and then back as it whiplashes. If you can imagine, this jello has different consistencies, some a little thicker densities and others a little bit lighter. So this image here is showing the gray matter along the surface of the brain. This is where the cell bodies of neurons are located. And you have all the white matter in the white sections. And these are called axons, and they're like the wiring extensions off those cells. But these two different tissue types are different densities. So when you have this shearing force of the brain, this is a vulnerable juncture between the cell bodies and axons to shear and break and get damaged. Now, sometimes imaging can pick this up. Sometimes you'll see it in a regular MRI, but oftentimes you'll need a more specialized one to actually look at these white matter tracks. And then we'll look into other diagnostics today about how else we can measure areas of injury to this site. But this is a big differentiator between mild and moderate traumatic brain injury as well. So in the image down below, you see again the gray matter and the dark orange or pink, and the white matter, the lighter pink. And you can see this little red tear here between that junction. So this is that shearing of the cellular structure that leads to all that whole inflammatory and swelling cascade, and then disruption of the communication of those neurons and what they do functionally. So we have the categories of traumatic brain injury here. So although our presentation is mostly focused of mild traumatic brain injury, everything that we're going to be talking about actually applies to all types when it comes to diagnosing and measuring brain function and how do we best treat it. But for all intents and purposes, we're focusing on mild to moderate. And I say mild to moderate because a lot of our patients present with a diagnosis of concussion when actually they have a moderate traumatic brain injury. And if we look at the differentiators here between mild and moderate on the top row, we already talked about a potential loss of consciousness or not at all compared to moderate. You still may not have a loss of consciousness, but in many cases you do. But the big difference in terms of symptoms is that there's more severe and longer lasting symptoms with moderate traumatic brain injuries. And then when it comes down to imaging, most often in mild traumatic brain injuries and concussion, there are normal MRI findings. Maybe there might be slight little white spots that indicate some of the axonal damage we're pointing out, but in most instances, it's normal. When it comes to the examination findings with the concussion, there may be just subtle transient findings of weaknesses with vision or balance, and then the rest are reported symptoms of headaches and confusion and whatnot. But in the moderate category, when we're doing examination, we'll see more significant sensory and motor problems. Eye tracking, balance is more severe, and there may be a very localized pathway that we can see on an exam that indicates a particular area of the brain is most affected and maybe a more severe injury there. But when it comes to imaging with this moderate traumatic brain injury, now you can see some maybe potential signs of that axonal tearing or injury related to a little bit of blood or hemorrhage there. If you do more sensitive imaging with what I call that diffuse tensor imaging, you can image those white matter tracks and be more easily to identify the damage. But a lot of times people haven't gotten these kind of tests, and the examination maybe have not been thorough if you're just going to a regular primary care physician when it comes to neurological testing. And you'll see as we get into our testing that actually many of our patients, and probably a lot of people with prolonged and more moderate to severe symptoms, but were diagnosed with concussion, actually have a moderate traumatic brain injury, and which makes sense about why you need more specific therapies. When it comes to severe traumatic brain injuries, it's much more obvious. People have severe changes of consciousness. They're usually loss of consciousness, often coma, and then more severe fractures, swelling, contusions, things like that, that are structurally identified and need a lot of other ancillary care in the ER and hospital. Um, this is an image of the brain, lobes of the brain, and generalized associated functions. On the bottom half here is the blue section called the cerebellum. This is generally the balance and coordination area. It receives all input from muscles and joints, so it allows you to just stand upright without thinking about it. And then the back half of the brain, in the yellow part, is the visual area called the occipital lobe or visual cortex. This allows us to see raw images and shapes, but actually defining and knowing what we're looking at is actually fed forward into the temporal lobe here on the side in green, is where we're identifying more color, texture, visual motion, and identifying what an object is that we're looking at. And then in the yellow section just above it in the parietal lobe, this is a visual spatial area. This allows us to see targets in space and where a target is. So when we combine all those elements of those three lobes of the brain, it's where we see and locate and identify what an object is. And a lot of times in concussion, we hit the sides or back of our head in these visual processing areas, which makes sense why you get light sensitivity and then visual motion sensitivity, headaches, and many symptoms like that. On the front half of the brain in the red, this is where all of our executive functions come from, in the frontal lobes. Thinking, planning, concentration, speech, all of those kind of aspects. So if we now take another look at the four primary categories of concussion here, we're looking at physical, emotional, cognitive, and sleep types of symptoms and impairments. The colors don't exactly represent the location where all these symptoms come from. They generally kind of do. But again, on the back half of the brain, we have in blue You can get issues with sleep. This isn't exactly where sleep disruptions occur specifically, but just as a category, we either have sleeping too much, not able to sleep at all, like insomnia, or just disrupted sleep cycles, or frequently waking up at night. Then we have physical symptoms where we have headaches, dizziness, light sensitivity, sound sensitivity, neck pain, all things physical. And then all the emotional side of things in red, this is irritability, anger, sadness, and just a lot of feelings of overwhelm. And then finally, again, in the front were the executive functions in the cognitive domain. We're going to further subdivide these and all the subtypes. And this list here is more thorough than what most literature provides, and it makes the most sense when we do it this way. So we're taking those initial categories and subtyping them, and we're working away from basically the top of the brain and body, or top of the brain, and working our way down through the brain and the body. What I mean by that is on the surface of the brain or front of the brain, we're talking about those cognitive functions with attention and concentration and slower thinking and memory, processing words, and disorientation. And then we have the mood changes of sadness, irritability, anger, and overwhelm. And then finally, all the sensory motor stuff. We have vision, visual processing, your eye movements as far as tracking objects or scrolling on a computer screen, or reading. And then the vestibular category is related to the inner ear. We have three fluid canals in the inner ear that sense all directions of head motion and then allow us to stabilize our posture and orient our eyes in that direction. When you have an injury or weakness to these vestibular centers, you'll have dizziness or vertigo that are especially triggered with changes in head or body motion. And that leads to other instability and steadiness with balance and gait. In the category of somatosensory, this is really all things related to the body, the head, neck, the entire body. So you can have headaches, neck pain, um, dizziness, numbness and tingling, weakness or spasticity of the muscles, problems with stability and balance related to input from muscles and joints. So all things physical function related. The autonomic category is related to the automatic control of how your brain controls your heart rate, your breath rate, your digestion, and your stress responses, and then also ability to relax. When that system is working well and normally, then it adjusts that oxygen and blood flow accordingly to what you're doing. Following head injuries, though, you can have a dysregulation or what we call dysautonomia. All of a sudden, you get rapid racing heart and feeling lightheaded with changes of blood flow. And that can happen with changes in position from lying to standing. So those are in the categories of dysautonomia. And then the sleep categories I mentioned about not being able to fall asleep, excessive sleep and tiredness, and then just waking up frequently throughout the night. There's also obstructive sleep apnea. All of a sudden, from a head injury, it makes more common to uh, produce obstructive sleep apnea as it changes the muscle tone in the back of the throat. And that also can lead to or impair the rate of recovery because now there's less oxygen for the brain while you're sleeping. So these are the categories of or subtypes of concussion. When it comes to the evaluation and identifying these subtypes, this goes into our functional neurology evaluation. And you're going to see it reflects exactly what the subtypes are. And that makes complete sense, right? We want a test or evaluation that measures the function of each of these categories. So on the top, we have the quantitative EEG, also known as electroencephalography. This is a way of measuring brain waves from the surface of the head, and we can identify areas that are either too slow or too fast, or areas of the brain that are not communicating effectively amongst each other. Medical neurologists will use EEG with a different type or just a longer recording, and they usually to try to measure or identify seizure activity or there's severe changes of consciousness. But the quantitative element is utilizing recording and quantifying and averaging the data, being able to differentiate these component parts for more functional information about the brain and what it means. Then we have cognitive testing. We want to do a computerized neurocognitive test to compare your brain function to a normative database. So then we're looking at aspects of attention, concentration, visual memory, verbal memory, and many components of cognition and comparing it to a normative database. And we're going to then use it again to repeat throughout your recovery process to identify what's changing and what's not, and how to lead to that, how to customize therapy off of that. The video oculography is a pair of infrared cameras that we place over the eyes to objectively measure eye movements. These are reflective of specific pathways from the top of the brain that controls voluntary tracking of eye movements versus reflexive eye movements that come from the inner ear or brainstem related to head and body motion and balance. This allows us to differentiate, is a symptom of like dizziness, for example, or eye strain or brain fog related to an eye tracking problem, or is it related to an inner ear problem? The somatosensory evaluation is really a comprehensive physical and neurological exam where we measure everything from skin sensation, reflexes, and strength, evaluating all the different orthopedic aspects of neck and back injury and other joints of the body, and then measuring your balance on a computerized plate to objectively compare, test which system from eyes, ears, or muscles and joints that are causing a balance or motor problem. And then the autonomic testing, this is a variety of strategies depending on each person of measuring your heart rate, blood pressure, and stress responses in either different positions from lying to standing to seeing if that's triggering symptoms, or other types of stress responses to your sympathetic system, your fight-flight system, versus what we call parasympathetic system, where it's resting and dilating blood flow through the body. There's different components of how we can measure these systems, and for each case that we'll pick certain tests based off of your symptom pattern and able to evaluate to see what's going on. And then finally, we have physiology, which means that we're going to do some blood work. And this is on a case-by-case basis, but we at least want to do the essentials to make sure that somebody doesn't have low blood sugar or they have low iron or anemia that's preventing oxygen to the brain, or maybe some hormonal imbalances. A lot of people may have read on the internet of some kind of pituitary aspect that gets injured and affecting broad range of your hormones. This is possible, but it's more rare. So again, you want to do that and screen with blood work and able to identify those kind of injuries. As this leads to personalized neurotherapy and rehabilitation, we want to take those exact findings from your evaluation and then utilize those exact functions to strengthen that part of the brain. That makes total sense, right? So first, we want to start with a supportive model to help get the most out of one's recovery. So we call this stimulate, engage, and train. And we're going to use categories of therapies or types of therapies to first stimulate the brain to activate, encourage oxygenation, circulation, and neuroplasticity for the brain. Then we want to engage the right system that we want to therapeutically strengthen and improve. And then we want to train that function of that brain or body. So we can categorize these as neuromodulation, stimulating or engaging the tissues to respond and heal and promote neuroplasticity, using biofeedback to type in either your heart rate or blood pressure, your muscle tone, or your brain waves, and then targeting that area for rehabilitation. And the categories of neuromodulation here. Let me get this here. We have neuromodulation that I mentioned is stimulates neuroplasticity, improves circulation, and engages specific neural pathways that we want to stimulate and promote recovery. And then neurofeedback is training brainwaves in real time. And I'll have Dr. Tolentino go into more depth of that. But in general, these neurofeedback helps with mood and cognitive functions and sleep maintenance and functions. And then we have vision therapy. Lots of different visual therapy processes to help with eye tracking, to help with the light sensitivity, to be able to focus and read. And then we have vestibular rehabilitation, working on the inner ear related to head and body and balance activities. that also involves a lot of eye movement training in conjunction with balance training. In the physical rehabilitation, we have all things that are related to supporting the proper healing of muscles and tissues, therapy of all the different joints that need to be rehabilitated, and dealing with chronic pain or headaches, and have lots of techniques to help along the way with all the different therapeutic exercises and pain management modalities for that. In the biofeedback category, we have the training the heart rate variability, stress responses, and a variety of techniques at home and in the office. And finally, we have diet and nutrition. We want to make sure that we're at least addressing mechanisms that help with inflammation, that help promote circulation, and help energy mechanisms in the brain so that all the systems have enough energy to do work, and we're helping manage other things that can perpetuate injury and brain and interfere with brain function. When it comes to our functional neurology evaluation, we're going to jump in a little bit more detail here to understand what each test does. And we started with that quantitative EEG, where we're measuring brain waves from the surface of the head. And when we do that, we are creating a map. We measure 10 minutes with the eyes closed and open, and then we feed that into software and edit it. Basically, we're getting the average power of the different frequencies of slow and fast waves, and I'll explain them in a little bit more detail. But we get these maps that look like this. This is a map from the top down, so we see the left hemisphere and the right here. And then we can see how the brain waves are distributed across the brain and what they mean. This quantitative EEG directly measures the real-time physiology of those neurons. Remember in one of the first images when I talked about concussion and the definition of concussion, about the gray matter and white matter, and the types of injuries we get from that region called diffuse axonal injury. Well, EEG is a direct measure of the cortical layer, that dark matter or gray matter. And we can see these cells here in that gray matter, and the EEG is directly measuring that and its relationship to the axons and connections that they have below it. And so it's a very objective way to identify if there's an injury in these pathways. So we gather this data, and then we use the software to differentiate each of these signals. On the slowest wave here, well, let me just back up for a second. Your brain produces a combination of slow and faster waves, and each waveform communicates different kinds of information. On the slowest ones on the bottom here are delta waves. These are usually not present much in the awake recordings that we do in our office because they're present in deep sleep. When the fast activity on the surface of the brain turns off, your brain is doing a lot of deep memory consolidation while it's in deep sleep. It releases growth hormone during this phase of sleep, and it helps promote healing. But if we're doing an awake recording and we see a lot of delta waves, this often indicates an injury to the white matter, those axons again that I was referring to. And that's how we would see that in a map. The theta waves are related to, it's still considered as slow waves. Historically, these theta states, if you will, are associated with creativity, visualization, imagination. But if we see too much of these slow theta wave activity, it usually means the region of the brain is too slow and struggling in its function. The alpha waves in the middle here are 8 to 12 cycles per second. This was the first wave discovered, which is why it's called alpha. It's related to all the primary sensory processing systems in the brain, involving vision, hearing, and input from your body, called the somatosensory area. All of these three senses go in through the middle of the brain where we have the sensory gatekeeper called the thalamus. And then it's distributed to the regions of the brain that processes that information. This is called the thalamocortical system, and it's all reflected through alpha waves. So the importance of this is that this operates as a pacemaker for the brain. So our alpha rhythm determines our brain's processing speed. But since it's a direct reflection of the sensory processing of these systems of vision and hearing and body input, if we see an asymmetry of alpha waves, we can identify exactly which pathways are involved and what to do about it. And finally, the beta waves and gamma waves are related to cortical activity, or say beta waves are related to executive functions like thinking and planning and concentration. But we're doing these recordings in a resting state. We're not having you do a test like calculating things or making decisions or concentrating. You're just sitting there resting in a chair. So if we see a lot of hyperactivity in beta waves, it can also mean mood and anxiety issues or sleep problems. The gamma waves at the very top are really an emergent property of brain function when brain regions are communicating and functioning together. So we're not going to go into detail with this slide, but I wanted to show it because we have patterns of brain activity that I was just describing in the different frequency ranges, that there are certain patterns that are reflecting reflective biomarkers of brain injuries or conditions like migraines, anxiety, depression, PTSD, and much more. You can see on the right, these are different combinations of how these dysregulations present themselves and how they reflect biomarkers of these conditions. So that's the process we use in the evaluation and why we can gather so much meaningful data. The cognitive testing, we like to use CNS vital signs. It's been around for a very long time. It measures all of these different domains and it compares your brain to a normative database. And it's really great for using for serial testing. If you're trying to do or want to do a baseline concussion test at the beginning of a sports season or just for your brain health, this is a great test to test maybe every 6 months or once a year. During the recovery process with our patients, we do it approximately every 20 visits. We repeat this test along with the brainwave analysis and compare these issues with cognitive functions and compare that to what we see with the brain waves and all the other sensor motor processing. Video oculography. These are the infrared cameras that I was mentioning. We're objectively measuring eye movements that reflect the visual tracking and also the inner ear of the vestibular system. This is just a snippet of an article showing the importance of eye movements being one of the greatest windows into brain function and how each type of eye movement can reflect specific injuries to the brain, and they're really objective and reliable to measure. This is just with one type of eye movement called saccades, when you jump your eyes left to right from one target to the next. This entire circuitry is involved in that eye movement, and it involves both left and right sides of the brain that we can differentiate just with that simple eye movement. And without going into too much detail, but the back half of the brain is where you can see a target in space, and then you identify it in the temporal region. But once you identify a target in space, like if you're looking at my thumb, once you can see the object of the thumb and jump your eyes to it, you're already initiated to communicate to the frontal lobe from the back half of the brain to the front. So when we're doing this video oculography or eye testing, we're measuring each component of these pathways, and when there's a breakdown in specific functions, then we can know where that brain injury or problem is. These different kinds of eye movements reflect aspects or changes in attention and cognition as well. So just like I was referring to, if you're having a visual spatial problem, your reaction times to attending to targets in one side of space or direction will be more impaired and affect attention versus maybe specific ones with other kind of eye movements related to a rule or strategy is related to maybe memory and executive function, following more of like a command. Then we're finally going to test your balance with a computerized plate. It's called posturography. We're going to measure how your balance is on a solid surface with your eyes open and closed, and then on a foam surface with your eyes open and closed. This is a report that we generate when we do that. In the graph to the right here, where you see the gray and red and green bars, this is the conditions that we test here on the bottom: eyes open, eyes closed on a solid surface, eyes open on foam, and eyes closed on foam. And the gray indicates what is average amount of sway in that condition for that person for age and height. And if it's in the red, it means that there was way much more sway than there should be. So that is abnormal. So this person has a very abnormal balance with their eyes closed on a solid surface and on foam. So it's much more severe. And finally, we were talking about the biofeedback assessments. There's a lot of different kinds of biofeedback assessments. One, you can measure skin stress responses on the skin, kind of like a lie detector test, specifically reflecting your sympathetic system, your heart rate, your breath rate, and the variability of your heart rate. And now I'm going to jump into a case study to kind of put all these pieces together. This is a 66-year-old female with post-concussive syndrome. She had a slip and fall and hit her head on the cement, which is one of the worst kind of concussions you can get because a fall onto cement is really hard and the impact ends up being a very fast speed, but with an extremely hard surface with the concrete. So those are end up leading to quite significant head injuries. She presented with headaches and migraines, visual processing, dizziness, and a ton of cognitive issues and balance problems. She presented about 2 years after her injury, and she still was not able to do the work that she loved to do. She was an author, a writer, which is an author, and a speaker. And she wasn't able to write effectively well and speak. She couldn't even go into crowds or bright lit environments because of all of these symptoms. I'm not going to show all of the tests, but I want to just describe all the different kind of cognitive and visual and balance issues that she had. So she had all the subtypes of concussion with her case, and that's pretty common in our clinic to see all of these subtypes present. And when we're looking at the quantitative EEG here, we're looking at a cap that she was wearing that has 20 sensors on it. And each sensor is represented as a box or square on this illustration. And we're looking at it from top down. So each box here is a sensor, and it's illustrating the brain waves from slow to fast, left to right. So the dark red here is those slow delta waves. Then we have the bright red, which is theta. The alpha is the yellow. And the green and blue are the beta waves to the right. And the first thing we want to look at to interpret these findings is to look at the peak of alpha, which is the yellow peak. In a normal brain distribution, the only real peak we should see in all these boxes is a yellow peak. And it should be symmetric in height and speed in all locations, left and right. We measure your peak alpha speed, as I remember telling you that alpha is related to visual processing, particularly at the back sensors here are related to the visual processing. And your peak alpha represents your brain's processing speed, if you will. And we can measure that peak right here, which is about 10 hertz. And then we can compare that left to right. And you can see this little dot here. This little dot represents the speed or hertz of frequencies range. And this is a 10 hertz point right here. So you can see this is 10 hertz, but there's a second peak here in alpha that's slower. And the whole alpha range is shifted to the left where you get red, the theta range is coming into it, which means that this alpha component in the auditory processing on this left hemisphere is slowing down. And you see it accompanied by the bright red and the dark red. And if you recall, the dark red, when we see it in these recordings, is reflective of white matter injury. So we're looking at a diffuse axonal, mild, moderate traumatic brain injury in this circumstance. And we can see that it's much more pronounced on this entire left side. So these are visual and auditory pathways. And deep into here is where the memory center is, called the hippocampus. So that makes sense of how you get visual motion sensitivity, concentration and word finding problems, reading and writing, all reflective in this left hemisphere. The bigger dysregulation there is, the more impairment that you have in symptoms. So that is really the summary of what's happening with this brain on the left hemisphere. You'll see that there's also the same pattern on the right, but it's not as severe. The primary injury site is the left, even though both hemispheres need support. This is a comparison of 1 month of treatment from May on the left to July. doing a combination of neurotherapy, neurofeedback, and neurostimulation techniques, and neurorehabilitation. You can see just globally, just kind of generally looking at it, that there's a massive difference between the left and right. All the height of these waves, which are this amplitudes of these dysregulations, have decreased. There's a lot of hyperactivity that also was calmed down. And if we fast forward to um, well, this is actually a way to compare changes, this two graphs that I showed you, comparing the difference between them. And anything, again, we're looking at a map here from the top down, and now each box represents the changes of before and after. The blue line is the initial recording, and the red line is the follow-up recording. And another way to illustrate that is that anything below this horizontal line here is what has decreased from previous, and anything that's above the horizontal line is what has increased from the previous. And what we see here is all this dark red and yellow has decreased from the previous recording. This is a really good change because this was all a lot of slow activity that we didn't like. That shouldn't be there. It's there from an injury. So there's a really good trend of improvement. Now, 3 months later, we do another comparison view and we get even more substantial improvements. So the first month of treatment, she was about 50% improved in all of her symptoms. 3 months later, now we're into like 40 to 50 treatment sessions because this is a quite significant brain injury. Now she's about 80 to 90% improvement, able to do every single activity from exercise, reading, writing, doing presentations, presenting her work at conferences, all successfully with minimal symptoms. She has a few periods where she might get her brain gets tired with a busy event and might get some light sensitivity or sound sensitivity with that. But overall, return to life, very happy, and still does occasional maintenance therapy with us. This is just an example of the raw data, that whole dysregulation on the maps that I showed you on the left. You can see it here in the raw data outlined in the red boxes that you'll notice if you kind of look at the whole thing, these are slower and more wobbly. They have combinations of sharp and slow waves and with a little fast activity within it. So this, when we see these patterns, we know we're going to see what that map looks like, and we can use more software to differentiate exactly where the source is coming from. And this is an image that looks from the top down, this area when I was referring to related to all the sensory processing that occurs in the temporal lobe is right here. So this is called the insula. It's a major sensory hub that integrates vision and vestibular, all sensory input from the body, all input from your entire physiology of your body, like your gut and your heart rate, and it controls your autonomic nervous system, your stress responses. When you have a dysregulation in there, you can get all those kind of symptoms like migraine triggered by vision or stress or light or sound sensitivity, and you can see it reflected from this region of the brain. And again, that hippocampus or memory center is shown right here on the far right when you see this red section deep tucked under the temporal lobe on the inner side. That's why we knew that was reflective of her symptoms. So I'm going to have Dr. Tolentino take it over here for the remote neurotherapy and go ahead.
Yeah, so just to kind of reiterate what I said before, we've spent a lot of time trying to find solutions for bringing better access to these kinds of techniques to people. We have all of these different options in our office, but I know a lot of people find barriers who maybe can't access the office or maybe need longer care plans. So this is why we've developed these remote neurotherapy programs. So um, we found that with a lot of patients dealing with significant symptoms, whether from concussion or other complex neurological conditions, whether that's migraines, chronic dizziness, movement disorders like Parkinson's or dystonia, long COVID, eventually limitations to getting enough care come up, whether that's distance or commute to the office. You can go to the next slide. Whether that's taking time off from work or from school, family responsibilities. ultimately finding limitations in cost and time. So our goal with programs that we've developed for remote neurotherapy have been to address each of these obstacles and make it easier to reach goals for recovery. So I really wanted to bring it back to this slide to kind of emphasize the process of wanting to stimulate, engage, and train the brain when it comes to treatment. So when concussions and TBIs occur, there are direct injuries to the tissues in the brain. So how do we target these injured tissues and dysregulations in the brain directly? A lot of the time with concussion care, this is the piece that's missing. So when we get into more significant and persisting symptoms, usually like physical therapy and exercises just aren't quite enough. So they a lot of times can be too taxing on an already overburdened and sensitive brain and body. So that's why we use this layered approach, starting with neuromodulation to promote healing of these tissues directly. And then we have more capacity to engage and train the systems using other therapy techniques like biofeedback and neurorehab. So I'm just going to go kind of briefly through some of the different techniques. I'm going to go kind of quickly here, and we'll provide people with a recording of this so you can kind of pause and review some of the devices that we have. But just to introduce you to neuromodulation, so non-invasive neuromodulation, it refers to the use of targeted electrical, magnetic, or light stimulation to modulate the activity of the nervous system. So this approach gently stimulates the brain or nervous system to promote healing, neuroplasticity, and to entrain neural activity to a healthier and more optimal state. So we use the QEEG to develop a personalized plan that targets those specific regions that are needing support and that have been injured. So these are just some of the common types of neuromodulation techniques, whether that's in clinical practice or in research. So in our clinic, we really emphasize and focus more on photobiomodulation or transcranial electric stimulation. So photobiomodulation is the use of usually infrared light to help stimulate oxygen mechanisms, energy mechanisms, and circulation to get better blood flow and better energy to those tissues so that they have enough energy for healing and for doing more work. And then we can also use transcranial electric stimulation, so really low level electric direct stimulation of the tissues themselves in order to bring them more online to prep them for more advanced activity and training with biofeedback, neurofeedback, or with neurorehab. There are also other types of neuromodulation techniques like transcranial magnetic stimulation. This is a more intense type of neuromodulation used in conditions like drug-resistant depression. And there's also transcranial ultrasound stimulation, usually used more in research applications. But using these kinds of therapies, you can address a lot of different conditions. You can see the list there. So brain injuries being one of them. So this is why we like to use it with concussion rehab. So going into more of the other devices or techniques. So I've already mentioned photobiomodulation and transcranial electric stimulation. We also have vagus nerve stimulation. So this is to help control or stimulate the nerve that controls the parasympathetic system. So this is your rest and digest system. This can really help to abort things like migraines, helps with inflammation. So this is really important and powerful technique. There's also audiovisual entrainment. So this is taking advantage of those pathways that Dr. Chung went through to help to stimulate and modulate those systems and promote healing in those specific systems and pathways. And then we also have peripheral and cranial nerve stimulation. So this can help to heal nerves or to stimulate the nerves in the head, neck, and face that control things like pain perception. So you can help to abort headaches and migraines and just help kind of shift symptoms. And then we have biofeedback. So biofeedback is the measurement and training of any physiological phenomena so that an individual can learn to better regulate their physiology. So a lot of times symptoms can occur when our systems get stuck. So biofeedback is the umbrella term for measuring any kind of phenomenon in the body, whether that's muscle tone, skin temperature, breath rate, heart rate variability, galvanic skin response, whatever it is. If you're able to measure it, you can see what things you can do to get it to shift in different directions, whether you're trying to increase something or decrease something. So that's biofeedback. So this helps to teach you how to re-educate the brain's control of muscle function, for example, and to better self-regulate the autonomic nervous system, which is key to balancing stress and relaxation responses. So these are just some of the types of biofeedback that we use in the clinic. So there's HRV biofeedback, like I mentioned, for training HRV, so heart rate variability, to improve autonomic function, and this can help with the different conditions listed there at the bottom. And then we can also do blood flow biofeedback, so that's the Mendy biofeedback to help improve blood flow to the brain. We can also do skin temperature to help improve blood flow to the hands, which isn't maybe necessarily the primary goal, but the idea here is that you're training the sympathetic nervous system, which is what controls that process. And then we also have EMG biofeedback. So this is to better learn control over muscles. So that can be whether it's just chronically tight muscles, or in the case of like dystonia, where you're having an imbalance in muscle tone between groups. So you can retrain control of that system to improve function. And then I'm gonna go into EEG biofeedback a little more, which is also known as neurofeedback. And for neurofeedback, you are measuring, actually, I'll just go into, these are what some of the devices look like in the remote program. So on the left, you see what the remote neurofeedback kind of cap. It looks very similar to that, where you're able to measure the brain waves and train on your phone at home. And then you have the Mendy biofeedback, same thing. You have a little band, you just wear it, and you can train all from the comfort of your own home, which is really convenient and nice. So going more into neurofeedback. So again, this is another name for EEG biofeedback. So this is a specific type of biofeedback where we're measuring brain waves using the same technology that we measured them during the QEEG. But we can measure and target very specific parts of the brain that are identified as being dysregulated or injured. And we can measure those brainwaves moment to moment. And when the brain happens to shift into a better, more regulated state, we provide the brain with audio and visual feedback that it finds rewarding. And the next moment, the brain might shift out of that state, and that reward or that feedback stops. So through this iterative process, the brain starts to notice, oh, when I'm making these brain waves, when I'm more regulated, as we determine what regulated is, then I get more feedback. So let me devote more resources to becoming more efficient at becoming more regulated and shifting into that more regulated state. So this is a learning process. It's operant conditioning, if you're familiar with that. But through many repetitions and consistency, just like exercise, the brain learns how to achieve those more regulated brain states, so that once you stop doing the training, it becomes a permanent shift and a permanent, more regulated
We
flexibility.
offer a free phone consultation for anybody who wants to know if they're a good candidate for our care and what is the best evaluation to get started on. 15-minute call is really just, we're going to ask very detailed questions about your symptoms, what you've been doing for it, how it's affecting your life, being able to screen what is the best evaluation for you to start with, or if we need to, you'd benefit from someone else's care. So please follow us on Instagram and YouTube. To follow up with us, you can either just give us a call or follow up on an email on the website below here. And you see our email here at hello@neuroaccesshealth.com. You can also find us on the website. We're going to shift to the question and answer period. But thank you, everyone, for coming. And we look forward to continuing to offer more interesting webinars to help train from home and also here in San Francisco. All right, have a great day.